Hi, I'm Dr. Kashif Piracha. I'm a double board certified physician. I'm board certified in internal medicine and nephrology by the American Board of Internal Medicine. I am an academic hospitalist at Houston Methodist Willowbrook Hospital in Houston, Texas, and I'm the clerkship director of internal medicine for Texas A&M University College of Medicine at the Methodist Willowbrook site in Houston, Texas. I am also a fellow of the American College of Physicians, American Society of Nephrology, and National Kidney Foundation. The way guidelines shape clinical decision making, there are some pros and then there are some cons. So, first, let me just discuss what are the pros. So, the pros are that obviously guidelines sort of standardize things. So, what we have is that we have different associations, we have different medical societies, and there's a lot of complex research going on at all times, but it's very difficult for a clinician to be aware of all the different complex research going on in a particular topic. So what guidelines do is they standardize by bringing the results of the research that has been done into a sort of format where it can be turned into a recommendation. So that standardization is important. And that actually also makes sure that the recommendations we are giving clinicians to treat patients are actually part of evidence-based medicine. And that's really the most important reason why guidelines are necessary, because they standardize best practices. But on the flip side, one of the negative aspects are that a lot of times I've seen that guidelines are used as a rule book. Clinicians can become too rigid when applying the guidelines, and that's the problem. So the reason that's a problem is that a guideline may be based upon a particular clinical topic, for example, osteoporosis. But then not all patients with osteoporosis are the same because they have different comorbidities. So you will have patients with osteoporosis with heart disease. You may have some patients with osteoporosis who have peptic ulcers. You may have some patients with osteoporosis who have Parkinson's disease or dementia. So guidelines, when you are applying guidelines in clinical medicine, you have to individualize them for every patient and not be too strict and rigid. So that's the negative aspect. Sometimes clinicians can be too rigid. So what I want them to do is to use the guidelines as a guide and not really as a rule book. The biggest difference that I've noticed between the way US guidelines work and international guidelines work is the first one is that US guidelines are decentralized, and UK and other countries, European countries, their guidelines are centralized. In the US, guidelines are most of the time given by professional societies. Take an example, there is an American Gastroenterology Association, AGA, and then there is an American College of Gastroenterology. And so they both have their own guidelines for gastroenterological disorders. So it's the decentralized system. Now, in the UK and many European countries, health systems are centralized. So they have a central body that issues guidelines. That's the first difference. The second biggest difference, and that is a big one, is cost effectiveness of treatment recommendations. So the US guidelines, for the most part, they look at whether a treatment works, but they don't take into account the cost of that treatment. And that's a big difference. If you look at the UK and other European countries, they will take into account the cost of the medication, because what they want to make sure is that if they are issuing a guideline with a particular drug in it, and that drug is so costly that a lot of people may not even be able to afford it, or they cannot dispense the medication, then that guideline is going to have a hard time being applied to the patient population. And you go through the whole trouble of creating a guideline, and now you have circumstances where most of the patients cannot benefit from it. So, but in the US, we focus on the treatment's efficacy and make sure that the treatment works, and don't take the cost effectiveness into the equation as a factor. But those are the two ways I think that the guidelines differ the most. I think the risks of relying too heavily on national guidelines as compared to international guidelines, I think there are four main points that I would like to make. So the first important point is slower adoption of innovation. So what happens is that in many instances, international guidelines can look at a particular disease, a particular treatment, and they can look at it before a similar set of guideline is published in the US. So if we look at international guidelines, we can put it into practice, but if we stick with the US guidelines, there will be a lag period. The second way is there may be limited generalizability and skewed data, because national guidelines are actually based upon a particular country's population and demographics And so that is going to differ from country to country. Also, the ethnic origins may be different. So if someone is sticking too much to the national guideline, then they are just looking at how a disease behaves in their own population, which may be quite different in which how the disease behaves in other ethnic groups or other patients with different demographics. So that kind of skews your data and limits your generalizability. The third way is also to reinforce a local bias. So again, remember, when you're looking at national guidelines, that is going to be dependent upon the national prevalent circumstances. There may be some political pressures. There may be some other factors which may be which may cause the national guidelines to be not as robust, sort of creating a medical echo chamber for that particular population. And if you go internationally, you can make guidelines which can be much more thorough. And the fourth point is that rare diseases. So remember that sometimes we have guidelines for rare diseases, and rare diseases are rare, and you may not have a lot of rare diseases in the national population of the country where the national guidelines are being framed. So you have to look internationally. So if you just stick with the national guidelines, sometimes you cannot come up with a good guideline for rare diseases. For rare diseases, you have to include the sample size as big as possible, and sometimes that may not be possible to accomplish at a national level, and you will have to go international. So there are a couple of different resources that I can recommend to anybody who's trying to stay updated, whether it's about national guidelines or international guidelines. The first one is just PubMed. So you can just go to PubMed and you can put the disease or the clinical condition about which you want to find guidelines. And they have a very robust tool in which you can filter your results. So I think that's really a very good resource, especially the filter about how far back do you want to look for a particular recommendation. And when it comes to internal medicine, the tool that I use that has helped me a whole lot is the Mix app from American College of Physicians. So Mix app is a very robust tool, and it has a lot of very good information, and it is updated very frequently as well. For those clinicians or physicians who would prefer an audio option, Oakstone provides an audio companion to Mix app, and it's also very thorough. And I personally listen to it, and I think it's a very good tool that these physicians can use to stay updated.